Hello, I'm Dr. Brady Wyrick, and I am East Idaho's only chiropractic neurologist, and I was also the first chiropractic neurologist in Idaho. Now, not a lot of people are familiar with chiropractic neurologists. Just like in the medical profession, if you have general practitioners and you have specialists. The same thing applies for chiropractors. We have general practice chiropractors and we have specialists within the chiropractic field, and I'm the only board certified chiropractic neurologist on this side of the state. So we're going to take a few minutes here and we're going to talk about vertigo. Vertigo or dizziness, sometimes described as lightheadedness. It can have many different definitions and also have many different causes. Okay? A lot of the stuff that we see comes from a part of the area of your brain called your cerebellum. It's right here. If you take the back of your hand and you touch that little bump on your skull, you can actually feel where the cerebellum is held. The cerebellum has three main functions. It does balance and coordination, it controls spinal muscles, and it also controls some eye movements. Now, if the cerebellum has decreased in its function, it can show up as dizziness. Now, most people, when they have had dizziness or vertigo for some amount of time, they've been to every specialist you can think of. And they've had every test done to the inner ear. Well, guess what? The inner ear, you have those little semicircular canals in there. The nerve from those canals directly inputs into the cerebellum through what we call the vestibular nerve. So if there's a problem anywhere in that process or in that system, it can show up as vertigo. Now, how we treat this is, first of all, we're going to test to see if your cerebellum is doing its job. We can test this very simply by having you do things like touch your finger to your nose like this with your eyes closed. There's some other cerebellum tests we can do to see if this is functioning. Now, our office does some clinically proven neurologically based treatments to get this thing working better. Now, your nerves, they're just like muscles. You exercise them, they get stronger. If you don't exercise them, they're going to get weaker. So our treatment is designed to exercise your cerebellum to get it working the way that it should so that your vertigo or your dizziness goes away, if that's the cause. Now, what you should do is call my office and talk to my staff and set up a free consultation so we can assess this and see if this is your problem to see if we can help you. Thank you.